began 5 years ago, even before we were established, by sponsoring graduate medical education in 108 teaching hospitals, 18 separate countries. Our second strand is global surgery. In this, we have a bi-directional education initiative. That is, the University of Nairobi, by way of example, surgeons are in an exchange program with noted American medical schools to see how surgery is practiced in a low middle income country. The third strand is what we're going to talk about principally today. 5 years ago, the then governor of Meru addressed the General Assembly of the United Nations in New York. And there he introduced the idea of neglected surgical diseases, which began in Meru town. As we practiced our camps in rural villages in Meru and then Embu counties, we found that 70% of our patients were female. Even though we only had one official women's disease, namely obstetric fistula, the others were hernia and clefts and clubs and so forth, many women showed up with a prolapse, with a fibroid, with a myoma, with pelvic inflammatory disease, all manner of diseases of women. This got us to thinking that maybe we should have a camp devoted to neglected women's diseases, and that's precisely what we've done. We started with 6, those that I've listed for you, but we didn't stop there. If a woman shows up and she's ill, we look after her. It could be medical, surgical, chronic, episodic, otherwise. We operate 50 or 60 one-day clinics annually in Meru and Embu at present. The level 5 hospitals in Meru and Embu counties lend us a clinical team. And we run our clinics by diagnosing, screening all patients who show up. Those that have an itis, that's an infection, an inflammation, and minor surgical issues, we treat them right there at the camp, about 30% of those. The thing about our electronic medical record, it's the data from one clinician is immediately available to all of the others. So information that's been gleaned by the nurse is instantly available to the surgeon. What he enters into the record is concurrently available to the sonographer. We find that the accuracy of diagnosis is elevated from 80 to 95%. But we can do an API build out, and that record can be married and synced to the medical record of the Embu Level 5, the Meru Level 5 hospital. We're all about partnerships. We worked with people in cleft palate, club foot, and Cataracts and Fistula Foundation. In addition to that, we have a brand new partnership with ALLM. They have AI-enabled equipment that's going to take via villi sampling for cervical cancer to a whole new level. Another important partnership that we've just concluded is with Her Excellency, the First Lady Rachel Rudeau, and her charitable organization called Mama Doing Good. One of their essential health initiatives is to screen 350,000 women for cervical cancer per year. Our camps touch and change lives in many ways, from as simple as a pair of glasses for somebody who had trouble reading, to somebody who's had surgical illness for many years and without successful repair. The satisfaction of what we do is in these outcomes.
Nilikuwa nimegonjeka kwa muda miaka mingi sana kwa shida tu hiyo ya tumbo. Nimefanyiwa operation mara 7. Hiyo ndio ilikuwa ya 8. Walipokuja wakaniangalia wakaona shida zangu, ndipo hapo wakasema wacha wanisaidie, na nikashukuru. Wakanisaidia, wakanilipia hizo mesha kwa hiyo kwa tumbo. Damu pia nilikuwa nimeishiwa, nikaeko pint 4 na dawa za kunywa kila kitu. Sasa nimeshukuru sana kwa sababu saa hii hata naweza kutoka mbele ya watu. Kama sio DeckerMed Africa ningekuwa nimekufa, kwa maana nilikuwa sina uwezo mwingine. Sasa hii niko sawa kabisa. Tumbo imepona kabisa na niko sawa.
In conclusion, I want to express my gratitude for everyone who is here tonight, for the corporate partners and you individually. Your support enables us to continue our mission and expand that mission to provide quality, free health care to women.